everybody, welcome to Happy Soul Mother and Child YouTube channel. This is our very first video. We are going to be taking more of videos, making sure that we give you all the information you would like to know, and then also helping you to know things you are not paying attention to. Okay, I would like to first of all inform you what is Happy Soul Mother and Child about and where is it coming from. Happy Soul Mother and Child is a private practice owned by me, and then it was inspired by the observation that I have made when I was working in a tertiary hospital, in a government tertiary hospital. So I have realized that our systems are actually overwhelmed with lots and lots of patients, and then that's where we start getting the challenges. It's not the issue of quality per se, but it's rather the overwhelming. So I thought if I could just give a private service that is affordable to many women, and then it will try to mitigate the problems that we see in the tertiary hospitals, because remember, most of the problems that occur emanates from antenatal period, which is what I'm doing the most. So Happy Soul Mother and Child seeks to see women with the low risk pregnancies. However, if you didn't know that you are a low risk pregnant, you shouldn't worry. I do a full assessment and write a report, then refer you accordingly. We do have a backup gynecologist that we work with for people who prefer purely private care and one are on medical aid. We do have the gynae who's going to see our complications and the pregnant mummies who are beyond the midwifery level. And then those who do not afford gynecologists but would like to attend with us, and we do see them. However, if ever you have things that requires an obstetrician, we definitely refer you to the state gynecologist. Then you'll be seen there, because we give everybody a maternal case record that is written, everything, so that wherever you go, the person who's going to see you has all the information that you require. So we work in a sphere of different practitioners. We do have a sonographer that we work with to help us do at least the booking sonars, making sure that by the time I see you, I have the full information of your fetus. I don't want to just use your estimated date of delivery to calculate your weeks and my obstetric will. I want to make sure that the sonar has been done. I know exactly all your biometries. That is knowing where, if ever the baby is growing well, the bipyramidal diameter is good, is the one that is correlating with your gestational age, the fluid content, all the 4 quadrants have good volume. I'm not dealing with any kind of polyhypodramias or oligohydramias that can indicate problems that would need investigations. So whatever I get from that sonar is the one that is going to guide me with the management. Hence, I require every mommy who comes to us to be done the first booking sonar. So if ever you are not comfortable to be done by the sonographer, but rather you would prefer an obstetrician, I do send to our gynecologist. However, I've got the mandatory sonar visits that I do strictly with my obstetricians. We are talking about the sonar that you do between 21 weeks and 24 weeks, and the one that you do between 32 weeks and 34 weeks. And then I've got the third one, which depends on how the baby grows. And then that one I recommend it at 37 weeks to make sure that the baby is fitting to the canal. It's just the anatomical or ultrasound to check if ever your birth canal is going to be adequate enough for your baby to pass through. I'm trying to avoid things like obstructive labor during the delivery, because I'm strictly doing the normal delivery. Anything that deviates from that, I send it to my gynecologist. So I usually do that to the mummies who gain the weight very quickly with the very high rate. I need to make sure that the weight is coming from just the normal fat pregnancy, or it's coming from the baby who's growing too fast. So that's why I don't do it to every mummy, especially with the parity. It depends how many times have you been pregnant and how many times have you got the normal vaginal deliveries. That will also tell me where we stand with your adequacy of your pelvic, because I don't want to let problems to, okay, I'm that proactive person. I prefer to make sure that everything is going well before I can get surprises. So we see all those mummies who are pregnant from the very first time they know that they are pregnant until 6 weeks post deliveries. However, we also see women who want to do pap smear. So we don't only do pap smear to our pregnant mummies, but rather every woman, because pap smear plus human papillomavirus check is helping us to prevent the cervical cancer, which is a dead condition, rather a disease. So it's better to prevent it, because if you know earlier, we send you straight to the gynecologist to take care of that and make sure that you survive the cancer. We don't isolate the pap smear with the human papillomavirus check, simply because it might happen that by the time we check you, we find that the cells are still okay. However, you still have the virus. It's just that it hasn't caused any harm. So you find that the time you are waiting for your next checkup, the cells starting to change. By the time you come, you already have problems, yet you did it. Remember, pap smear is not done routinely. It's done in 2 to 3 years, depending on the reasons. So if you've got a special indication that is from your obstetrician that says it must be done every year, that's the only time it is done annually. However, most people, it is done in every 2 to 3 years, depending on the age. It is recommended to every woman from the age of 21, but highly recommended from age 25 upwards, to make sure that you don't develop such. So we work with Ampath Laboratories to make sure that you get your results within 7 working days, so you can have an informed decisions from there. So I'm sure you must be wondering, who is Sister Gomomo? It's important to know who is dealing with your lovely babies, so that you can get the comfort and confidence, and who is taking care of your babies. Okay, Sister Gomomo, who is me. I have a bachelor's degree in nursing, which comes with midwifery, community healthcare, psychiatry, and general nursing. So I also have an experience both in public and private sectors of midwifery and everything else, including the ICU. Sister Gomomo is the one person who's so eager about obstetrics. The way I love obstetrics, I want to take care of the mummies in further and many more ways that it's going to save lives, because maternal death has been the most problematic thing in our countries, especially the developed countries. So I want to be one of those people who's going to make a difference. Hence, I didn't further my studies in advanced midwifery. I rather took a new journey and branched to medicine to do my medical degree, whereby I'll be able to specialize strictly in obstetrics and do the complicated type of obstetrics, which is called perinatology, which is also known as maternal-fetal medicine. So as it stands now, Sister Gomomo is also a medical student who's doing her her senior years. So don't be surprised as to where is what. As a result, I'm not going to only give strictly obstetric information on these videos, but I will give other information based on how to take care of the baby even after the 6-week period, because I still believe a baby who is less than 3 months is still a little person who really needs a vigilant attention. So for you to know what to do, what to check for, you really need to know how are these things presenting at the early stage to prevent death and other complications. So if you follow us on our YouTube channel by subscribing, you're going to get more of these videos and more information. You can also follow us on our media platforms, where I'm going to be sharing these links. And we're there on Twitter, Happy Soul Mother 1. We're there on Instagram. We're there on Facebook. We are Happy Soul Mother and Child. So you are welcome to ask any question. We are going to pay attention in all your questions, your comments, and everything. And then in the next video, we'll be definitely answering your questions. So if I take time to answer your questions. Don't worry, I'm going to get back to you because remember, Sister Komomo is also a medical student, so I need to go to the hospital and do my clinicals where I am learning more and more of the challenges that you guys face every day. I love public hospital because that's where I get the feel of the real thing. I have worked in the private sector, I have seen it all, and I personally feel like in the private sector, everything is under control. You hardly see most of these things that are affecting our society. That's why I love public care, because in the public, I have learned a lot. I was able to identify our problems. I was able to identify the challenges our pregnant mummies face and all those things. So you are welcome to ask the questions. We have our WhatsApp number in all of our social media platform. You are welcome to send us a WhatsApp. I can answer on the WhatsApp. Otherwise, you can inbox us in any of the platforms there. We'll be able to answer you. I hope you enjoyed these videos, guys. I'm looking forward to teach you more and more things and give you more information. They say an educated world is an informed an informed population is a powerful population, because education is the one that makes you make an informed decision. So please take care of yourselves, drink fluids, eat well, exercise, and make sure that we get these good outcomes in the pregnancies. I'm gonna see you soon. Thank you.